This is a case presentation of complex abdominal wall reconstruction using fully resorbable ENFORM mesh and bilateral transversus abdominis release. My name is Dr. John P. Fisher, and I'm a reconstructive plastic surgeon. This patient is a 57-year-old morbidly obese gentleman who was successful in losing approximately 40 pounds prior to surgery and has multiple large abdominal incisional hernia defects related to multiple prior colon operations. He also has significant intertriginous fold irritation and issues related to his abdominal pannus. His preoperative cross-sectional imaging, shown here in this axial CAT scan, demonstrates multiple significant large abdominal wall incisional hernia defects. As we can see in the imaging, these defects begin in the upper abdomen and span all the way down to the suprapubic region. These hernia defects are both symptomatic and painful for the patient, as well as associated with significant functional impairment. The defects measured by CAT scan were at least 15 centimeters wide, and ultimately intraoperatively were measured at greater than 25 centimeters wide. The multiple defects presented a challenge in terms of reconstruction, and ultimately, intraoperatively, these were created into a singular defect for optimal reconstruction. As we can see as we head caudally, multiple defects are present in the abdominal wall. After successful rehabilitation and a weight loss of approximately 40 pounds, which returned his BMI to below 40, we proceeded with surgery, and this included excision of his abdominal pannus, extensive exploratory laparotomy and lysis of adhesions, retromuscular dissection, as well as the use of a transversus abdominis release and placement of submuscular ENFORM fully resorbable mesh as shown here prior to fascial closure. After the fascia was closed, we placed multiple submuscular as well as subcutaneous surgical drains and placed an incisional negative pressure wound therapy device as shown here. These important adjuncts for soft tissue management help reduce complications in high risk and challenging patients. This patient, given his history of COPD, diabetes, as well as obesity, is at very high risk for perioperative complications, and thus preemptive strategies, including weight loss and adjunctive techniques, are imperative. In this postoperative axial CT, you will see successful abdominal wall reconstruction, intact myofascial abdominal wall without hernia, as well as complete integration of the resorbable ENFORM mesh, which has further reinforced the abdominal wall. This postoperative CAT scan highlights the benefit of a transversus abdominis release, both in terms of reconstructing the myofascial abdominal wall, as well as providing a very large plane for placement of wide mesh for abdominal wall reconstruction and reinforcement. Postoperative evaluation at 1 year demonstrates no evidence on physical exam of recurrence and significant improvement both in pain as well as disease-specific quality of life as measured by the abdominal hernia cube a disease-specific, patient-informed quality of life measure for hernia patients. There was a 63% improvement in pre to post-operative quality of life at this 1-year time point. Also note stabilization of his soft tissue envelope, absence of any persistent intertriginous issues due to successful functional paniculectomy, and overall a substantially improved contour of the abdominal wall, now in a hernia-free state. This concludes the case presentation of complex abdominal wall reconstruction in a high-risk patient using submuscular, fully resorbable ENFORM GORE mesh.